Hello, I'm Robert, and just trying to say the positive side of the last video as fact checker and science blog and helping people scared of Covid-19. So Boris Johnson has put the entire country that I'm in lockdown, the United Kingdom, and I am not even permitted to go out of my house except once a day for some exercise or for essential things. Now, this has separated everyone from everyone else. But what else does he have to do? So the Dr. Tedros said in the last video conference, he said, you can't win a football game only by defending, you have to attack as well. Physical distancing are important ways to slow down the spread of the virus and buy time, but they are defensive measures. To win, we need to attack the virus with aggressive and targeted tactics, testing every suspected case, isolating and caring for every confirmed case, and tracing and quarantining every close contact. So this is what we have to do next. Because of the week that's just gone past, not keeping the eye on the ball at all, then we have no idea where the virus is in the United Kingdom. It can be anywhere. Anyone could have it, unless they've taken the precautions that of being very rigorous about washing it off their hands and so on. So we have to find it, and that is absolutely essential because unlike flu, if someone in your household has Covid-19, they probably haven't infected anyone else yet. Because Covid-19, flu is infectious for a very short time and then infects loads of people in that very short time in the household. Covid-19 is infectious for a very long time, up to 2 weeks after the end of your symptoms. It's still infectious. And Covid-19 can take an absolute age to infect someone else. So if you've got someone else in your house who's got Covid-19 and they're coughing and they've got a fever, chances are they haven't infected you yet. You even get husband and wife where the wife has Covid-19 and the husband doesn't, or vice versa. And even they've been together on a cruise ship, and also there's an example on a cruise ship of the wife had Covid-19 and she was just very puzzled because her husband didn't have it. But that is normal for this disease. It's really hard to get it. And it's only spreading so much because it's infectious for such a very long time. So in that situation, the absolute priority is to find all the people. Now he's locked us all down in our households. The very last thing we want is for the people who got Covid-19 to start infecting the other people in the same household. Because what will happen if he doesn't do anything? So he has now got to, with utmost urgency, he has got to go through all of the households in the United Kingdom. He's got to buy maybe 100 of those machines that will do 1,000 tests a day. And then he'll be able to do 100,000 tests a day just by buying 100 machines, which the United Kingdom could easily afford. And then just go around and test everyone. Everyone who has the fever, the Covid-19 symptoms should be tested. Instead, they're telling us not to ring them up. They must turn that around and tell them to ring them up. And say, if you think you've got Covid-19, ring us up. We will give you a free test. Just come in. And it's always free on the NHS anyway. We're going to give you a test. And don't worry if you are an undocumented immigrant, or you're unemployed, or you're not up to date on this or that. We are going to just give it free for everyone because it's absolute urgency to find everyone, and then just say, oh, you're Covid-19, you're not. And then keep retesting, testing every day. They should be testing everyone who's got symptoms, who hasn't tested positive yet, and who hasn't been proven to be something else. And then once they've done that, so that is the aggressive testing every suspected case. So I'm just telling you what Dr. Tedros said. Testing every suspected case, because we've lost sight of the ball. we have no idea. Everyone in the UK who has a fever and a cough is now a suspected case. So we've got to test them all. And then, having tested them, we've got to isolate and care for them if they're confirmed. Now, isolation for COVID-19 is a very different thing from what the United Kingdom is recommending. And just, I told about this before, I won't go into any depth, but Dr. Whitty is basing his advice on a fictional flu disease, such as you would do for pandemic simulations, that is not the real world disease of COVID-19. So he is conducting all this like he would have conduct a pandemic exercise, say, for a fictional disease, where he's made up all the parameters for the disease, and he's telling everyone what to do based on those parameters. But this is a real world disease, and it's not the same as his model, which is a fictional one, which would be fine for an exercise, but it's no good for the real world, because this is a different. Isn't the same, just not the same disease. And so the WHO advice for COVID-19 is that caring for infected people at home can put others in the same household at risk. So unlike flu, as I said, if you've got COVID-19, you're not going to infect others very easily. So the WHO say that the patient and the caregiver should, this is Dr. Tedros' short summary, they've got very detailed instructions, but his short summary is a good way of summarising it. So they both should wear a medical mask when they're together in the same room, and they should sleep in a separate bedroom and use a different bathroom from everyone else in the house. And there should be only one person who cares for the patient who's got COVID-19, ideally someone who's in good health and has no underlying conditions, just in case they got it. The person infected with COVID-19 can still infect others after they can, and then they've got to, they should wash their hands after any contact with the patient or their immediate environment. If they do all this, then they can care for someone with COVID-19, and if they did this very thoroughly, and they don't make any mistakes, and they always, when they go in, when they come out, they wash their hands, they're both wearing masks, and the other person doesn't cough in their eyes. But you would normally have goggles if you were a doctor dealing with a patient, but in this situation, then the other person, the patient is wearing a mask as well, so they're not going to be coughing on you. Their mask is to contain their coughs. Your mask is to give you a certain measure of protection, and then and you use the mask properly. So there's detailed instructions on the WHO website as how to use a surgical mask. There'll be disposable masks. You'll have a new mask every day for that 14 days, and then not 14 days, not a set time. It's until they are recovered, that your patient is recovered, if they've got the mild case, with 80% of the time. And then it says after that, the people infected with COVID-19, it's unlike flu, can still infect others after they stop feeling sick. So these measures should continue for at least 2 weeks. At least 2 weeks after symptoms disappear. So this is what we should be doing. So they've got to go round, test and find all these people, and care for them properly in a way that does not endanger the other people in the house. So Granny doesn't go and sit in the same room as their daughter who's got COVID-19, and they don't use the same bathroom. And then the COVID-19 patient is being cared for in this way. We should be doing that right now as utmost urgency. And so I'm not going to talk, I've talked plenty before in previous videos about what the government is doing wrong. I'm talking about what the WHO say we should do, which is based on the real world disease, and not doing this as real world consequences of people dying. And people are going to be dying in large numbers because the UK advice is based on a fictional disease for pandemic simulation, rather than a real world disease for real world instructions based on the real world disease. And we absolutely have to do this. And the fictional disease that they're working with can't be controlled by contact tracing because of its characteristics as such as to make it impossible. But the real world disease can be controlled in this way, because 80% of transmission is in this very close contact, which can be stopped, and it's not airborne. So being in the same room as someone with this is not going to give you it. It's not going to give you it. It's only if they cough in your face or they cough on a surface, you touch that surface, you then touch your eyes, nose and mouth. And if you don't do that, and viruses are not like microbes, they're just a little bit of a genetic instruction plus protein. They're easily destroyed with soapy water. And most of them are very easy to destroy with soapy water. This one certainly is. So wash your hands thoroughly all over, and the detailed instructions as to how to do that, which I've got in my separate article about it, which I'll put in the video description. So this is what our government must do with absolute utmost urgency. They must also not just test people at home, they must test all the patients in hospitals with utmost urgency, because the action so far probably, I think near certainty, has started an outbreak of Covid-19 at least one of our major hospitals in the country, because this did happen in Wuhan several times, and they were far more cautious than we are. They didn't know what they had, but in the early days they just didn't really know what it was. We are going to have people going into hospital who think they're free of the virus because it's 7 days after the symptoms started, and they just ring up and doctor say, "Oh, I'm not feeling very well, I've got a heart attack, or I've broken my leg, or I've broken my ankle or something," and then there won't be any precautions being taken in hospitals. And this must have happened several times over the last week, and this has almost certainly started infections in hospitals. So I would, if I was in a position to be able to say what to do, which I'm not, then those would be the two things. But so now what I'm saying, now you can just say, "Oh look, he doesn't know what he's talking about," but it's not me, this is the WHO. Read the WHO yourself. The WHO are absolute experts on this. So then read what the WHO said. Everything I say is cited. Read my article, read what the WHO say, and then decide for yourself, and then start a discussion with other people and look for experts. Then present this to people who are expert, and then say, what is your answer? If you know any of the epidemiologists involved in this study, say, look, your disease, your fictional disease differs from COVID-19 in these ways. What is your explanation? Why are you giving the advice based on a fictional disease instead of COVID-19? And this is a dialogue that has to happen, because this is a real world and people are going to die in large numbers. Not only that, we have 10,000, we're just coming short of 10,000 cases, and that's not including all the people with mild disease sitting at home who've been told not to ring up the NHS. So there must be many more than 10,000 who've got COVID-19 already in the United Kingdom. And that means it's increased fivefold, at least fivefold. It might have increased more than fivefold in the last week, and then it's going to increase. So next time, by the end of next week, it'll be 50,000. Next week after that, it'll be 250,000. Next week after that, it's more than 1 million. This is how this thing increases so quickly. And we just must not let that happen. And it's not just for us. It's also because of the people in countries like sub-Saharan Africa, where the people are much more vulnerable than we are. So our old people, anyone over 90 especially, as 1 in 5 of them are going to die if they get it. And nearly 1 in 5, just slightly under 1 in 5. If they've got underlying medical conditions, then more than 1 in 5. So that's what's going to be happening. And we're going to have care homes. And John Ashton was saying in question time that he says that the government has figures that if it gets into a care home, then 30% of those people, so out of 100 old people, 30 will die. And he says that that's the government's figures that they aren't sharing with the public. And so I don't know whether that's true or not, but it's well believable, because that fits the what you would expect from this disease, from the vulnerability of old people, plus many of them having underlying conditions, will make it worse. And 30% is not unbelievable for an old people's home. And then I worked out how many doctors, if it's spreading in hospital, and if we don't immediately stop it now, and it may be in one hospital, it may well be that in one of our hospitals, half the doctors already have it. And if it gets to the point where half the doctors around the country have it, then 1,000 doctors are going to die of it. No. Yes. My son was right. 1,000 would likely die based on the mortality figures. I used the age ranges of doctors and the numbers in each age range, in each age group. Now I used the mortality figures for Covid-19, multiplied those together, added it all up, and mostly elderly doctors, because some doctors keep on practicing when they're quite elderly, but there's some quite a few young ones as well. 1,000 would die in the course of the outbreak if it gets to the point of half of all the doctors in all the hospitals getting it. The hospitals being focal points, if you're not protecting them, where people are going to be infected. And then goodness knows how many patients are going to die of this. It's just absolute top priority. We must do something about this. Even if you disagree with this and you don't think I'm saying the right things, then please check and start these dialogues going with other people. And read my article, check the facts that I've got there, and then I've got quotes from the paper. You can check for yourself. It's a fictional disease. It's not based on the data. You can check the data from WHO. I've got loads of fact checks there. I've got the long list of people saying how awful this is at the end. Just check for yourself. No, and not random YouTubers, but absolute experts, medical experts. It's got down here at the bottom. Let's bring up. Oh, that's WHO recommendations. So these are the reactions. Reaction to UK announcement. That was my own reaction. But here's John Ashton. He said, "Don't know where to start really. I'm embarrassed by the situation in this country." And another one said, "Well, I'm tearing my hair out really." This is the Professor John Ashton, former president of the Faculty of Public Health, and who is also in advising the Kingdom of Bahrain on their COVID-19 policy. And so he says, I'm tearing my hair out really with this, very frustrated here. I'm with Richard Horton, the editor of The Lancet, with Dr. Tedros, Director General of the WHO. I think it was a kick up the bottom, particularly for this country. We've got a place in that attitude. It feels wooden and academic, and we've wasted a month when we should be engaging with the public. Now it spreads the way it looks like it spread. There'll not be enough hospital beds, and people will have to be nursed at home. And there's not going to be enough ventilators probably, and then there could be lots of, he didn't say all that, but I'm just going to add to it. And there will be these doctors and nurses. Here are my figures for the doctors and nurses. A very simple calculation, basic maths, nothing complicated. This is the number of doctors aged 20 to 29, and at the 0.2%, 38 would die. And these are different figures of all the different percentages. 70 plus, then that is quite a high number. 358, 463 over 70, 358 doctors would die over 60, 168 over 50. This is assuming that half the doctors get infected with COVID-19 in the hospitals. So surely before that happens they're going to stop it. But every day is increasing it. Every 3 days doubles the problem. Every week it increases it by fivefold. And if they are making it harder, it's possible that every week is even increasing it tenfold. Anyway, so better stop there, and do please give this some thought and think about it. Is this right? Should we be doing this? Should the UK be going in this completely different direction? And look, this is the Italians. The Italians been struggling so hard to contain their outbreak, and Jamie Smith, he was a professor and head of microbiology, and saying, he's vice principal and professor in Edinburgh University, James Smith, and he was speaking to his Italian colleagues, and I haven't got it. And he said their opinion isn't translatable in any polite way. I mean, can you imagine they've been fighting this so hard in Italy? Italy, by the way, just now seems to be turning around, and then they hear that the United Kingdom is just going to let people wander around their hospitals with Covid-19. They're not even going to try and keep it out of their hospitals. They're not going to do anything really, and they're not even going to test the mild cases. They will stop the contact tracing, which they've been working on so hard on in Italy in order to control the outbreak. They've been working really hard to control the outbreak in Italy, and meanwhile the United Kingdom is just letting it blow up. And this distancing, this physical distancing, is not going to stop it, because people are still in their homes infecting others, and then people infecting others, they have to go to hospital and they don't even know they've got it. I mean, I've never seen anything like this in my life. And I've seen some strange things over the last year with the climate change things, but this is even more bizarre than some of those. And please don't be angry with these people. Please show sympathy with them. This open letter from scientists in Italy, this is to appeal to you to urge your government to act now to actually stopping the virus in most EU countries, to quickly slow it down and stop the contagion with much less effort and cost of what is now needed in Italy. If Italy had strongly acted just 10 days ago, and that is more or less where you are now, they're now talking about before the UK did its thing, there would have been much fewer deaths and economic tumble. And South Korea and China should be taken as an example to follow to stop this epidemic. There is no other way. So please make your best effort to urge your government to act now. Time is our common enemy, as the virus is very fast and really lethal. Every minute is exceptionally important, as it means saving lives. Don't waste it. Take care. And that's from the frontline workers in Italy who see what this does. We are going to be in that situation very soon, within days. We are going to have people who are saying to the rest of the world, don't do what we did. Act much more quickly. We're going to have doctors saying, look, we've got lots of doctors dying, don't let that happen in your country. This is going to happen within days, or within a week or two. Now, I would be surprised if we don't get to this position within 2 weeks. In fact, we might well get it to a situation by the end of this week, that we have doctors writing these letters to other parts of the world saying, don't let what happened to the United Kingdom happen to your country. We absolutely, and please, every minute is exceptionally important, as it means saving lives. Don't waste it. Do what China did. Do what South Korea did. And quickly stop it as quickly as you can. So we have made a first step that will let us do this, which is, okay, lockdown has located the problem. All the people aren't going around infecting others, but they are infecting people in their own household, which is where 80% of the infections happen. We absolutely have to find these people now. And then we have to do all the precautions to make sure they don't infect anyone else. We also have to ask them, who were you in touch with before? Because some of them won't be symptomatic for another 2 weeks. We've got to go around and find those people too, which will be in other houses, and say to those people, you are a contact of someone with Covid-19, you've got to self-isolate too. So you're going to find all the contacts of all the people with Covid-19, got to get all them to self-isolate. And then if we do that, then we will be in a very strong position. And when you do that, then the number of case infections immediately stops. So you get the impression that it only happens after delay. It doesn't. It doesn't happen after delay. The infections stop immediately. They're reduced, or even come almost very small, or reduced as soon as you do that. But you don't notice the difference, because it takes, on average, on median, half of the patients take 3 days. Some may take many more, some take a bit, may take less, but the midpoint is 3 days before you start the symptoms, and then it takes typically another 6 days, but China's got it down to 3, before you diagnose it. So the peak of diagnosis is a week or more after you do the cut shutdown. So if we today were to stop now, our numbers would keep going up for another week. They would seem to. Those are all people that have already been infected, that would then develop symptoms, and then they get the diagnosis. It'll only be the end of next week. So if we were to stop this all now at 10,000, which is probably, if they check, suppose they check everyone in the United Kingdom, they find 20,000 people or 30,000 people with this. We stop it all now. It will still keep going on up and up. It will seem very alarming, up to maybe 40, 50, 60,000 people that we'll find have got the virus before eventually it stops. And then that will seem to be the peak. And then it'll start going down. So it's not the number, the cases per day will be in the thousands, and then they'll gradually start going down. And then we'll see the peak. The peak will actually happen now of the infection, but we won't see it in the diagnosis until a week later. So we can do that right now. And this should be our absolute utter, every minute counts. Every minute is exceptionally important, as it means saving lives. Don't waste it. And follow the example of China and South Korea. That's what we absolutely have to do. And all this wasting time with these theoretical infectious diseases, this is what we have to do. So anyway, I'm going to stop there and hope this helps. And please share this with other people. Share this video. Share this article. Talk about it. Discuss it. Debate it. Get the attention of decision makers. Get the attention of the scientists. Get these scientists to explain themselves, and very quickly explain themselves, and confront them with this and say, look, try changing your model. Maybe, I don't know if they can change them, I doubt they can change their model that quickly as to put in all the parameters for Covid-19. These models are very complicated and difficult. They're probably just not programmed to be able to do it. So I don't think they can model it. Tell them to get in touch with Bill Gates. He's trying to model the proper Covid-19, but it's a big long job modelling something properly. Anyway, so that's the end of this video, and I hope this helps. I've been doing this is my third attempt. I'm just trying to be positive and try and map the way ahead that's positive, instead of kind of looking back and saying what went wrong, but what we've got to do right now. I've kind of got plenty about here about what all the issues are. So this is the most positive I can make it, and we absolutely have to do this. Do join our Facebook group, Doomsday Debunked. If you're scared about these things, you want to reassure people and help people who are scared of these things. The main thing on a personal level, you can stop yourself from getting this. So I'm going to give a video on that now, another one to remind you all about how you can keep completely safe from Covid-19. Well, you can just, if you are completely rigorous like the experts, then you will be able to say that I don't have Covid-19. I'm least risk because I'm doing everything right. Because it's not airborne, and the virus can be washed off. The virus is easily destroyed with washing, not just washed away and someone else can get it, it's just destroyed. So you can completely destroy it on your hands, and if you do the right things, it can only get in. It's not a contact virus, it can't get through the skin, it can only get through your eyes, your nose and your mouth. It's the only way it can get into your body. So if you can protect those, but not with the mask unless the mask doesn't work, because you just don't use it properly, and so it gets in anyway. So it's the hand washing and is the way that you stop this. So anyway, that's that.